Absolutely. Pleasure to be here. But before we start, I would like to give you a little bit, an overview of it. As you already know, breast cancer is the second most common cancer in the world. And nearly every year, 2.1 million people are diagnosed worldwide, right? And also I'll say around 600,000 people, they die from this disease. So out of all the breast cancer, around 15 to 20% are HER2 positive. And since so many years, we have our drugs. The first one was Herceptin in 1998, and we have got additional drugs which can treat this HER2 positive population. And there's been tremendous progress in the overall survival for these women. However, 40 to 50% of the people or women, they have like low expressions of HER2. And obviously, up till now, there was no personalized medicine for that or targeted treatment. And these people were given like standard of care, like chemotherapy or hormone positive, depending on their status. So there's a huge unmet medical need in this population. And that's why I think Roche, along with pharma partners, we have a companion diagnostics, and we worked on this because it was such a huge need for our women also. So as I mentioned before, there was a huge unmet medical need, right? So the test is exactly the same. And what we have done is we have expanded the capability of this test and broadened the scope so that now we can also test HER2 low women, and they can be given a targeted therapy. So that's where we came for. That was the whole motivation, that how can we ensure that? And for that, what we had to do was standardize the test, make sure what the instrument detection and everything was there, so that every time when this test is run for HER2 low negative women, it is reproducible and accurate. And so that was the whole motivation behind this. So the test, how it's performed is like basically what you have to have, make sure that the protocol is locked, and we have the instrument and detection kit. So all that is a package. Along with that, then this test is run on the patient. And along with it, what is also very important is that how can the pathologist then read this assay? So that involves a training, which we have right now. And we may ensure that, every time the pathologist can read it accurately also. While we were developing the tests and why we standardize this so that we can detect the expression of HER2 across all four categories from 0, 1 plus, 2 plus, and 3 plus. And that way we can get accurate results. And in the past, HER2 was only HER2 positive or negative, right? There was no differentiation between negative, positive, and HER2 low. And that's where we have been focusing on. And I think that was one of what we submitted to the FDA, right? So our approval was there. We had a randomized control trial. One arm was standard of care, and one arm was with the drug, which is HER2. And what we observed and what we found out was that the overall progression-free survival and overall survival in these women was double than the standard of care. Wow. So as I said before, that this was a huge unmet medical need. Like how can these women, if they're just given routine stuff versus this drug, they will be eligible for this therapy. And another thing was there approximately, I think, 49% reduction in the risk of progression of the disease in these women if they were on this drug also. So that was what was very valuable, and that's why we got the approval also. Okay, so basically like HER2 targeted therapy, it is basically the HER2 protein is there, right? It is expressed on the tumor cells. So these therapies are very specific for that. But if the patient up till now, if it is negative for HER2 positive was defined, it is always defined by either there is protein expression, which is 3 plus, and 2 plus is protein expression plus gene amplification. So when that happened, the women were given this targeted Herceptin, Cadella, all those drugs which were there. And we never had anything between 1 plus, which is, there's a specific definition about membrane intensity and cutoff, and 2 plus without gene amplification. So that's where this targeted therapy is coming, and it is going to help women a lot in that direction also. So as I mentioned before, like approximately 40 to 50% of the women, they had this low expression of HER2, which was never treated before because there was no drug which could show its efficacy. So all these women, they'll now be eligible for therapy with this new drug.
Okay.
So which is a huge, huge unmet need. And overall for women, it is absolutely phenomenal that they may be eligible for this therapy. I think this test is exactly the same as it was before, except we have standardized it, right? And training is there. So healthcare providers, they can easily access with our test. If you have to give treatment for HER2 low, this is the only FDA approved test, right? And so they have to make sure that this test is run. And this is easily available, and they're already using, if they're using our test before, it's already there. So there won't be that much of difference as far as access is concerned. But it can be used now along with HER2 positive also for HER2 low patients also.
Discuss.
One comment, according to the latest data, is every 15 seconds, a woman is diagnosed with breast cancer. So as you can imagine, it's such a huge population out there which we can help, right? And Roche has always been innovative in looking into breast cancer, along with that also in general for women's health also. And another thing is what we could also look at is how can this test can be used in other solid tumors also? What are the avenues? So I think that's another innovation that is happening.